This last section from Chapter 6, Section 6-11, describes examples of articulations that demonstrate important functional principles of support and mobility. So we kind of highlight a few joints for you. So this is a list of those joints that will be discussed in this last recording. Intervertebral articulations, the shoulder and the elbow joints, the hip and the knee joints. So this will be a short recording. And we'll start with those intervertebral articulations. There are two types of intervertebral articulations. We have the gliding joints, which occur between the superior and inferior articular processes. So you can see here's a spot, here's a spot, here's a spot of gliding joints. And those are going to permit small movements, those that are associated with the flexation and rotation of the vertebral column. And then we also have the symphysial joints between the vertebral bodies. Okay. So the vertebrae are separated and they're cushioned by pads called intervertebral discs. And each disc consists of a tough outer layer of fibrocartilage surrounding a soft, elastic, gelatinous core, pictured here in yellow. Of the articulations of the upper limb, the shoulder joint provides the greatest range of motion. However, it's also one of the least stable joints. This joint is mainly a ball and socket structure with a relatively loose, oversized joint capsule. The bursa of the shoulder are especially large and numerous to reduce friction of the large muscles and the tendons that pass across the joint capsule, because it's mainly these muscles that stabilize the joint and form the rotator cuff. The elbow joint consists of two articulations between the humerus and ulna, and between the humerus and radius. The larger and stronger articulation is the hinge joint between the humerus and ulna. This is going to provide great stability but a limited range of motion. Its strength lies in the fact that the olecranon interlocks with the trochlea, and the joint capsule is large. This joint is reinforced with many ligaments as well. This next figure displays the hip joint ball and socket diarthroses between the head of the femur and the acetabulum of the ischium. This joint is very dense and strong. Due to a dense, strong joint capsule supporting ligaments and the bulky surrounding muscles and a nearly complete bony socket. And this structure can resist compression, absorb shock, and stretch or distort without damage. The range is less than that of the shoulder, but it's much more stable. It's more likely that the neck of the head of the femur will break before this joint dislocates. Although the knee functions as a hinge joint, the articulation is far more complex than that of the elbow or even the ankle. Since the weight of the body is upon this joint at all times, the rounded condyles of the femur roll across the tibia, so the points of contact are constantly changing. In addition, the tibia femur, the patella, and the femur also articulate here at the knee, pictured on the left. There's no single unified joint capsule, but there are many joint capsules instead, and the condyles are cushioned by the medial and lateral menisci. We also have a number of fat pads in the knee for padding. We have multiple ligaments from different angles that support the knee. Therefore, a dislocation of the knee is not very common. The patella is within the quadriceps tendon, which passes over the joint and becomes the patellar ligament that links to the tibial anterior surface. Additionally, the fibular collateral ligament and the tibial collateral ligament stabilize the lateral and the medial surface of this joint. We also have the posterior and anterior cruciate ligaments that are inside the joint and limit the movement of the femur. This last checkpoint asks you to do some critical thinking. If Daphne falls on her hands with her elbows slightly flexed, after the fall she can't move her left arm at the elbow. If a fracture exists, which bone is most likely broken? And that will conclude the Chapter 6 recordings.